Doc, how you doing? It's been a while.
I'm good. Yes. It's been 2 weeks.
Yeah, so how have you been?
Working, tired, but when it's Wednesday, then I get super excited because I get to come here.
Yes, and we also get to educate, I get to learn as well,
Absolutely.
Yes.
Absolutely. But where's Lexis?
Me and Lexis, we are your students. We are going to be medical doctors.
As for Lexis, he's almost graduating.
Lexis, he's senior. he is like, you'll be a surgeon, and things. Me, I'll be assistant surgeon.
Assistant surgeon.
Yes.
Okay, all right.
We use music to operate on people. Well, Doc, this afternoon we're talking about something that's very, very important for we the men as well. The more we age, the more we get scared about it. Prostate cancer.
Yeah.
And it's quite something to deal with.
Mm-hmm.
Well, before we proceed, maybe you can do us the honors of telling us exactly what prostate is. I mean, the gland itself, and then the diseases that come around it.
Right. Thanks, Sammy. And good afternoon to all our listeners, and it's good to be here again. And a special good afternoon to all the Man U fans. From here,
you're going to do
I'm going to get my chilled something and then
chilled pure water.
Yes, chilled pure.
so you guys are beating Arsenal, eh?
Oh, easy.
Sir.
So Mukai A2.
Yo.
It's their record. So all the Man U fans.
Your coach didn't fall down when he's going to the stadium.
Oh, that's why your coach don't mind him. we are not minding him for now.
No way. Next week Wednesday, I'll be here to remind you of the scoreline.
Right. So, Sammy, today we're going to talk about prostate health.
Yeah.
We're going to look at the prostate in its entirety, and not just look at prostate cancer. And I've decided we need to do this because about 49% of the population in this country have the prostate gland in their bodies. So men or males.
I thought you were going to say the cancer.
No. That would have been frightening. Right. So a significant chunk of the population would be interested in hearing about this.
Yeah.
And even if you are female, I'm sure you have a brother, you have a father, you are married, you have a husband, you have a boyfriend. So even the females also need to listen in.
Yeah.
But then again, Sammy, we are getting, or from where I sit in the consulting room as a healthcare worker, we're getting to see too many cases of not properly handled diseases concerning the prostate. And unfortunately, we get to pick it up when it's all shattered on the floor and patients are very ill.
Wow.
Then the last resort is to come to us. So I'm hoping that if we don't finish even today, maybe next week, we are able to let people know a lot more about the prostate and the diseases that can affect the prostate and how they can pick up the early warning signs and who to go to.
Very important. Yes.
So the prostate gland is a solid organ which is found only in men, and it's small in size. It measures just about some 3 centimeters by 2 centimeters, roughly.
And it causes problems like that.
Yeah, so small things in this world. It's about 20 grams too in weight. And it's shaped like a chestnut.
A chestnut?
Yes.
Interesting.
So, very small, tiny organ. It is made of muscle and glands.
Okay.
And then what we call fibrous tissue. So it's glands and then it's made of a lot of muscle as well. It is found at the base of the bladder.
Okay.
So the bladder is that structure that holds water, urine.
Urine, yeah.
In your lower abdomen, so when you get the edge to it, it's a big balloon, if you like, and it holds urine. And the prostate is found at the neck, as we describe it, of the bladder. Okay. And it also surrounds the tube that brings urine from the bladder outside, what we call the urethra. Okay. And for men, the urethra runs through the penis. So that hollow tube that connects the bladder to the outside, bringing urine from the bladder outside, is called the urethra.
Okay.
And the prostate also surrounds this tube.
Okay.
All right. Another important anatomy that I want to mention is that part of the prostate, the posterior aspect, the back of the prostate, it rests against the lower aspect of the rectum, where when you feel the air to poo-poo, the large intestine.
Okay.
It is very important we understand these relationships. The relationship of the prostate to the rectum, the relationship of the prostate to the bladder, and then also to the urethra. Because when we come to talk about examination of the prostate, I am going to mention certain things, and people need to understand why I am or why we do what we do. It's all because of these relationships. The exact function of this small, tiny thing is not known.
Doc, are you serious?
I'm serious. The exact function.
And it's in a very vital point.
It's a very vital area.
In between areas.
In between areas. Very delicate. If like this was here, that's the word he would use. He would tell that very delicate area. The 18, the 18-yard box. That's where it is.
Wow.
But to date, we don't know the exact function. I mean, we can tell you a lot about the function of the heart, the liver, the lungs. But when it comes to the prostate, we still don't know much about it. And as you rightly mentioned, it ends up causing a lot of problems too. But it produces some fluid.
Okay.
All right. And the fluid forms part of the human ejaculate. So during sex, when the man climaxes, the fluid that comes out, that's semen, part of it comes from the prostate.
Oh, okay.
That's what we know.
Okay. Okay.
But that ejaculate also comes from 4 other different glands. So it's not just all of it coming from the prostate. So even without the prostate, you will still have the fluid coming. But that fluid also contains certain important chemicals that nourishes sperms.
Okay.
So that's what we know about the function of the prostate. It's not a lot, but this is what we know about it. Right. Having said that, what are the common afflictions of the prostate? Number 1, and by far the commonest disease that affects the prostate is something we call BPH. BPH.
Okay.
Benign prostatic hyperplasia.
Okay.
Or if you like, when we say benign, it means harmless, harmless.
Okay.
Actually. So this is sort of like a harmless enlargement. And I'm saying harmless in quotes because it will cause you problems.
Okay.
But
because the little I know is over the years, the more you age, the more it enlarges.
Exactly. So when you are born, then those are the dimensions, very small, very tiny. Then with age, it gets bigger. But it gets bigger up to a point.
Okay.
But then in some individuals, then it begins to grow a lot more. Just take the size of your head. Imagine if it continues to grow every year.
There'll be a problem.
There'll be a problem. So it has to stop growing at a point.
Okay.
But unfortunately with the prostate, sometimes it grows even further. So 80% of all cases or all diseases that are affecting the prostate is BPH.
Okay.
All right. Then you have what we call cancer of the prostate or carcinoma of the prostate, CAP. So we've got BPH, then we've got CAP, which is carcinoma. When we talk carcinoma, then we are talking about a very terrible disease, cancer, malignancy.
Okay.
So benign, which is relatively harmless, and then cancer, which is very harmful.
Okay.
Right. About 18% of all the reasons why people come to us with prostate problems is because of cancer.
Okay.
Then we have something we call prostatitis, which is usually an inflammation of the prostate caused by an infection. The commonest cause of that inflammation is an infection.
Okay.
You can get an infection of, say, the bladder, the urine, and then there's a backflow. So there's a connection between the prostate and its tube, and then also the urethra, where the tube that brings the urine out. So that if you have an infection...
So the infection could spread into the prostate.
Exactly. So it spreads into the prostate. And this forms about 2% of all cases. So in terms of diseases that affect the prostate, you've got this BPH, then you've got cancer, and then you've got these infections generally. These are the 3 commonest. All right. So let's spend time and talk about the BPH.
Okay.
Right. What causes BPH? Exactly, we don't know. It's not clear cut. We don't know the exact causes, of BPH. But aging, as you mentioned, is a factor. The presence of a functioning testis is also a factor. We've realized that testosterone is an important, which is the male hormone, which is produced by the testis. I mean, your balls or is important in the growth of the prostate. So that's what we mean by a functioning testis. And then also if you have normal, testosterone levels in your body, all right, genetic factors also play a role in all of this. So we can't put our finger on it and say this is exactly the reason.
Cause.
Yes, the cause. But these are all, factors. We hardly see it in 20-year-olds or 25-year-olds. But then you see it beyond a certain age group. Definitely people above 50, then the incidence of it starts to go up. That's why aging is such an important, factor. Right. Because of the earlier biology that I described about its location in very delicate areas, the bladder,
yes.
the urethra, and then the rectum, when you have an enlarged prostate, it begins to give you problems with urination.
Okay, is it because the tube through which urine flows goes actually
through
the prostate?
the prostate.
I see.
And then the bladder, which holds the urine until you feel the urge to also urinate, is also, the prostate is just at the base or the neck of the bladder. So you're going to have symptoms with urination. So at the end of this conversation, what I want people to remember, if they don't remember the BPH and the CAP, I just want them to focus on symptoms of urination.
Okay.
And at least if you have any of these symptoms, then you need to go and have a chat with your doctor. So we divide the symptoms into two. We have what we call the obstructive symptoms. So, Sammy, you imagine something which is big sitting at the entrance to your door. If that thing gets big, it will obstruct your ability to get out of the room.
Very true.
Good. So these are what we call the obstructive symptoms. Straining. The first one is straining. So if you had to push to begin urination, then we will term that as straining. So usually urination is just one of those things we don't think about. You feel the urge, you just get there and then it comes.
Yeah.
But Sammy, if you realize that you have to push to begin urination, we call it straining. It's a sign of obstruction.
Okay.
Number two, there's something we call intermittency. Intermittency. Do you have to stop and start again several times when you urinate? That is what we mean by intermittency.
It's like
so you start
your
urinate.
engine is faulty. It goes off. You have to start.
Aha.
Wow.
So you start and stop, which is not the usual thing. Usually you stand there and then it just comes. Poor or weak urine stream. So everybody knows what their urine stream is. I mean, when we're all young boys or kids, there's a game that we play.
Who can urinate the furthest?
Exactly.
Wow.
Exactly. So as we grow, the stream becomes a bit weak. But then, if all of a sudden you realize this change, that you have very weak urine stream, then again, it may be a sign of obstruction. Then there's something we call incomplete bladder emptying. When you finish urinating, you feel free. You feel that, yes, everything has come out empty.
Yeah.
But if you have a sensation of not emptying your bladder completely after you have finished urinating,
so you feel like you still want to urinate again.
Exactly. You feel like you want to do it again just when you have finished. So these are 4 signs of obstruction to us that suggest to us as clinicians that your prostate may be enlarged. And therefore, you need to, examine it further or do other things. But if you are listening to me at home, then this is the time you want to go and talk to your doctor about it. Then also, because it is so close to the bladder, we have what we call irritative symptoms.
Okay.
Where the prostate is now getting big, and Sammy, like in this room, in this studio right now, if there are 10 of us here right now, we'll be bumping into each other and irritating each other. So as the prostate gets big, it tends to irritate the bladder.
Yeah.
It doesn't like it being so big. It wants it to be small and in its corner, minding its own business. So we've got something we call frequency. Frequency of urination means that if you're urinating again less than 2 hours after you have finished, then that is frequency.
But sometimes they also say that in order to keep your kidneys healthy, you have to be drinking water, let's say about, based on your body, your weight and all that, maybe 3 liters, 2.5.
Exactly.
Could all that play a fact?
Right, it could. I mean, garbage in, garbage out. If you drink a lot of water, you would pass a lot of urine.
Okay.
So that holds. So if you come to us and you tell us that, oh no, doctor, these days I've been drinking a lot of water and I've realized that I'm urinating a lot.
Yeah.
We would evaluate it differently.
Okay.
But you know yourself, you know the number of times you urinate every day. So if you realize, and this one we're talking about 2 hours, if you do it less than 2 hours, you do it and you want to urinate again, 2 hours, you want to go again, 2 hours, you want to go again.
And you're not taking any fluids.
And you are not taking as much fluids other than what you usually do.
Yeah.
Then we call that frequency of urination. The other irritative symptom is something we call urgency. Some of you are sitting right here in this studio doing this show, right? I feel the urge to pass you. You hold it until after the show. But some people can't hold it.
But Doc, let me ask you,
right,
now that you brought this up, is it healthy to hold urine?
Oh, as a habit, we discourage it.
Women do it a lot.
Yes.
They can hold urine now 4 hours.
But we'll ask them why.
But is
It's not healthy.
It's not healthy.
It's not a good practice. I think 3 weeks ago we discussed UTI on the show. I mean, it causes urinary tract infections. It predisposes you. It also doesn't help your bladder muscles, work well if it becomes a habit. But every now and then we are all caught in situations where you can't do it. You are in traffic, and our public health system too. You don't have our public places of convenience and so on and so forth. So urgency, the inability to postpone urination. I mean, if the urge comes, you realize that I have to go. If you have that, that's also an irritative symptom. And then the last thing is nighttime urination. I mean, at a certain age, you should be able to sleep and not wake up to pass urine. But if you realize that these days, 2 times, 3 times before dawn, you have to get up and urinate, then it may be a sign that your prostate is getting enlarged. So, Sammy, these are the symptoms of obstruction and irritation that may point to an enlarged prostate. And these are the things that I want everybody, to at least pay attention to.
Okay. So if you're out there and you have questions for Dr. Safo, you can actually send them via WhatsApp 0244340437. Well, Doc, are there any particular lifestyles that one can, let's say, try to get into to try and prevent? Because it's more like a lot of we the men tend to start worrying. I have a few elderly friends who tend to have this problem. Right. What are the things you can do whilst you're young to prevent your prostate from enlarging and leading to possibly cancer?
Right. So when it comes to what you can do to actually prevent the prostate enlargement, and you are right, the prostate enlargement could either be a benign condition or it could be a malignancy, a cancerous condition. And we can't tell unless we do further investigations of the prostate. So if it turns out to be prostate cancer, unfortunately, there's very little you yourself can do to prevent it, because again, genetics may play a role. Okay. And if somebody is your dad and he has prostate cancer, then the genetic factors are already there. Aging is also something that you cannot control, which also would cause you to your prostate to grow bigger. So you cannot control that. We've realized that it occurs more in blacks or people of African descent than Caucasians or people from the Orient and all of that.
Is it our color?
No, I think we have a lot more testosterone. Remember I mentioned testosterone as an influence, playing an influential role in enlargement. So that's why we do well in sports. And all of that.
I see.
We're not going to get any white 100-meter champion.
And we'll make more babies too.
Exactly. We can score high marks in the sense. So
what thing?
Oh, like this we know. We'll tell you more. So the testosterone is there, and because of that, we think that we are able to, and that sometimes adversely affects it. So in terms of what you can do to prevent it, there's actually very little. But smoking is a no-no.
Alcohol?
Well, not too much this time around. I think Philip can get away with it and his gang. I let them off the hook.
You see, when I asked that part, he started looking in this direction.
Okay. Well, this week he's free. Alcohol didn't feature much, but smoking and then also a high-fat diet.
High-fat diet. Okay.
So there was this study that looked at the Japanese, for example, and we realized that the incidence of prostate cancer in the Japanese men were very low. And it's because over the years they've had very low fat in their diet. Now their diet too is westernized. So high fat diet and smoking are the key things that you can avoid. The other things are factors that are really out of your control.
Okay.
But before we go quickly, I just want to mention some key things about how the prostate is evaluated.
Okay.
These days I see a lot of people going or coming to us that, I've gone to this place and then I've done this prostate PSA, and then they're shoving it at you. And people are doing all sorts of things. So I want to tell everyone listening that there are ways of properly examining the prostate. Number one, you need a clinical examination.
Okay.
That clinical examination is something that a lot of men cringe when we mention.
Is it the one that you are told not to eat, not to drink fluids for a certain time frame, and then you
no. That one is mild.
They insert some things.
No, this one we're going to insert. The doctor is going to insert his index finger.
Oh, okay.
Up your backside.
Your thigh.
Up your backside. I think maybe you ask like B, on Saturday, to explain that, in clear terms.
You should come for a medical edition of Weekend City Show.
So there's going to be what we call a digital rectal examination. It is not as uncomfortable as people think it will be, but that is the only way the doctor can get access to your prostate, and then we examine the prostate and then pick up certain features that will let us know that the prostate is enlarged and whether the enlargement is cancerous. Then we do a blood test. Then we can also do some ultrasound scan examinations and sometimes even take the biopsy. But the clinical examination, that digital rectal examination, is absolutely important, and you need to get a trained doctor to be able to do that examination for you.
Okay. Well, Doc, there has been word around, that maybe more frequency when it comes to intercourse can also, higher your chances of not having prostate cancer. How true is that?
People, this is why I say political question. They may want to get some leeway to be able to disturb.
It was sent to me by a certain honorable.
Well. I mean, I'd say that there's no scientific, firm scientific evidence that if you have more sex, then you are not going to have develop prostate cancer.
Okay.
I mean, that relationship has not been established yet.
Okay. Let me get to a few messages. One here says, I'm 11 years and I urinate frequently. My name is Benjamin. Well,
right.
We all urinated when we were 11.
Well, probably I don't know whether it could be bedwetting, but definitely 11 years, he's not within the range where we are concerned about his prostate. So I think his parents can give us a call and then we'll examine other reasons. It may be a UTI.
Okay. Doc, are you familiar with this?
Finasteride.
Yeah.
Yes.
Apparently it causes impotence. How true is that?
Well, finasteride is a medication. It's a medicine that we use in the management, medical management of the prostate enlargement. But it's not going to cause impotence. But it has its own uses.
Okay. One here says, "Good job, Sammy. Great topic, Dr. Safo. What's the best treatment for BPH? Is it the catheter or
Right. So a prostatectomy is asking about surgery. So again, when it comes to BPH, we've got medical management or something we even call watchful waiting, where sometimes it's not so enlarged for us to be concerned. So we'll ask you, come back in a year, or we'll tell you about these symptoms, and then we ask to see you later. Then we've got the medical management. I mentioned finasteride. There are a few medicines that we use to try and reduce the size of the prostate and allow for urine flow. And then also there is the surgical option. There are different types of surgeries, that can be done if it is BPH. So first, we need to do the thorough evaluation to determine exactly, what we're dealing with.
Okay. All right. Well, we're going to leave it here for now. I'm sure we'll continue with this next week. A message here says, tell Drive Doctor that his teammate and ardent Arsenal fan, Dr. Alex Akon will be watching, ready for the bet. Okay.
I used to play football with him. With Dr. Alex Akon.
So he's Arsenal and you're
Man U, and I'm going to call him.
All right, Doc. So we'll see you next week. Any score line you're predicting?
Oh, we'll be gentle. So 3 is okay.
Doc, next week I'll finish you. All right. Many thanks to MTN as well, bringing us MTN Draft Chat with our doctor, Dr. Osafo. He's going to be back next week, Wednesday. Well, straight for the news at 5, Ernest is here. Ernest, welcome back.
Thank you, Sammy. From the Joy Nation, we have the latest news headlines. Government is set to announce new investments in